Okay, hi everyone. Western Mass Wonder Woman here. This will probably be video 12 of my cancer journey. So I think the last ones I posted were 10, like 1, 2, and 3, because it was all kind of like one video. And then I filmed some stuff while I was in the hospital that I haven't actually put together yet, but I want to put that together and post that before this one, so that will be number 11, which will then make this number 12, and hopefully I get that all right and squared away. But anyway, latest video in the update, and this is day 2 post surgery. So I actually had my bilateral mastectomy on Friday. It is now Sunday, so I'll just kind of give you the rundown of what happened. I went in the hospital for 6 a.m. My surgery was at 7:30, so we had all the, running around to do in between. Not so much running around. I was laying in the hospital bed while other people were coming in and out of the room, talking to me and having me sign things, and I'm meeting with the surgeons again and with the anesthesiologist and all of that stuff that needed to happen. And I went in, and surgery was done by 12:30, and so that was good. They called my husband, let him know that everything went fine, and then I woke up at it was like 1:15. I remember being awake and looking at the clock, but I was still pretty groggy from the anesthesia, and I was trying to be awake, and they were telling me that I needed to, deep breathing, and it was just kind of like, it was like this weird 2-hour period where I was just like, not like I was awake, but not really feeling well, and I was nauseous, but that was all a side effect of the anesthesia, which is normal. So by 3:30 or so, they had brought me out of the recovery space into a room. So I had a private room, which was nice. It was like the size of my house, because we live in a very small house. So it was interesting to have such a huge room. But so they moved me in there, and then I was able to actually nap for a little while. And then my husband came when I woke up and brought me my overnight bag. And by 6 o'clock, I felt fine. By 6 o'clock, I totally felt like it was like, okay, I feel absolutely fine. I didn't feel like I had had surgery. I was like, I'm in, no pain whatsoever. Wide awake. Everything else felt totally fine. Had a little dinner. I only had a salad for dinner. But yeah, it was all good. I got to watch Wonder Woman on demand in the movie, in the room, which was great because, the rooms have cable and all that, and then I was looking for something to watch, and I was like, oh my god, Wonder Woman 1984 is on, so obviously I have to watch that. So that's what I did on Friday night. They put in a catheter, which I did not expect. It's the one thing that no one told me was going to happen that was really weird and kind of disconcerting, because, and apparently it's standard, like that's what they do, but I just didn't know that. So I did have a catheter in, which if anyone has ever had one, you know that it's annoying and it sucks. If anyone hasn't had one, it's annoying and it sucks. So I really didn't get out of bed for a while because I had the catheter, and then the hospital bed actually had these, they were really great, and I would actually love to get them for my bed at home. These leg wraps that they put around your calves, and they squeeze periodically to give you, to boost the circulation in your legs, to make sure that, the blood keeps flowing and everything. And it was just like getting a massage in your lower legs for the whole time, and it was really cool. But those were still connected, and I didn't know if I could take those off. So I just didn't know if I was able to get out of bed for a while, and so I didn't. But then eventually the evening shift nurse had come in, and she helped me figure all that stuff out, and we actually removed the catheter, and she took off the leg thing, so I was able to get up and walk around, and I was totally, fine. I was like, okay, well, this is great. I did start feeling a little pain in the chest at that point because all of the pain meds and blockers and everything that they had given me during surgery were starting to wear off. Saturday morning, um, there was a fair amount of pain. The pain scale goes from 0, which is no pain, to 10, which is extreme unbearable pain. And Saturday morning, I would say was probably about a 4. Um, so I had a couple of Tylenol, and then that kicked it back pretty well. So um, the pain has really been very manageable. I have a high pain threshold anyway. I used to work on horse farms, and I've had multiple injuries, and many of the injuries I've had in the past were way worse than this pain that I have now. Um, just like it's not even comparable. And just if anyone's ever thrown their back out, that's worse. So this pain is not, um, for me anyway. My experience is not that this is substantial in any way, and I can still breathe deeply, which I in the past, and I had bruised ribs before from being kicked by a horse, and I couldn't breathe for 3 months. So I'm like, oh, I can still breathe. This is fantastic. So so I had a little bit of pain meds on Saturday morning, but otherwise I felt good, and I went home by my 1 o'clock. My husband came, picked me up, and brought me home, and I've been home ever since. And really feeling good. The like I said, the pain is not that severe. It's manageable. I haven't taken anything else. I didn't take any. They offered me prescription pain meds. I didn't take any. I didn't want any. I knew I wasn't going to want any anyway. But I haven't even found that I never even would have wanted them, because it just hasn't been a problem. I haven't even taken another Tylenol or ibuprofen or anything. I did take homeopathic arnica, which, if anyone is familiar with that, that is a remedy that helps with pain and with trauma to the body. I took a dose of that last night, 2 doses of that last night. But that's it. And otherwise, everything has been okay. So they did go in and they, removed everything. They made a keyhole incision. So I'll try to do a little drama. So this is the lovely surgical bra that they gave me to come home with. So the incision is from the nipple down and a little bit, and then I guess they did a keyhole incision where they took out the actual nipple. So it was like shaped like this, and then they peeled everything back and took everything out, and then the plastic surgeon put everything back in. Because this is the breast, the left one is the breast that had the tumors in it, she had to scrape more of the tissue underneath. So, if you think of it, picture like any fruit with a skin, like picture melon or something, literally melon's melon. And if you're trying to take out, like if you have a cantaloupe and you're just trying to take out the orange parts, and you get down to the rind, and just imagine that the rind is the skin and the tissue. She had to keep scraping off all of that to get all the orange, cantaloupe meat, to make sure that she got all the cancer cells. So that made the skin then at that part very thin. So this breast is a little more funky looking right now than the right breast. The right breast was just a straight, tissue removal, to make them balanced. And, we're going to send this tissue off to the lab as well to see if that random spot that was there that was concerning to begin with is actually cancer of any kind or any concern. But so they're mostly symmetrical, but this one is definitely has a little bit more like modeling to it. It looks a little bit more bumpy and bruised because of the nature of what she had to remove in there. But supposedly that's all going to settle down, and eventually things will even out and become normal looking fake breasts. And I have drains. Let me see. I'm wearing bathrobes nonstop. I've become a robe person. I live in my robe now. Let's see. All right, so here we go. This is one of the drains, And so this is, it's underneath, it's sewn into my skin, and then the drain comes out, and then they attach it to the bra so that this doesn't hang down and then obviously pull out of my body, because that would be bad. That is not what you want. So the drains have to be emptied twice a day, and I have them on both sides. And that's, your body naturally produces all of this, fluids and antibodies and all the stuff that's going on in there. It needs an escape route. So that's what the drains are for. And anyone who's had any major surgery might be familiar with that concept anyway. So I have the drains in, so they'll be in. We have to measure, and once the amount of fluid that's coming out is a small enough amount for 2 consecutive days, then I can get the drains removed. So it usually takes about a week. So probably, it's Sunday now. So I'm hoping maybe by Thursday, Friday, I'll go back in and get the drains removed. And then that will actually just make things easier, because, the drains aren't bad. Like, they're just hanging out, like I'm wearing a bathrobe and they're just hanging out inside. But, it's just, no one wants to have drains hanging out of their body. I will say, one of the things I had looked into originally when I was starting this whole process and looking into stuff that I was going to need for recovery for when I was home, they do sell these shirts and things that are like drain holders, and they're like $50. And, there's like all these like elaborate things that people buy for mastectomies for recovery. That I am glad I didn't buy any of them, because there's no need. I'm wearing my bathrobe. So first of all, like I said, the bra actually holds up these drain cups. And the shirts that they sell are for the drain cups to be supported, but if they give you a mastectomy bra to go home with that supports the drain cups, you don't need that. And then wearing the bathrobe with a tie around the waist, it holds in the rest of it. So definitely, if anyone's watching this and going through potentially going to have a mastectomy, this is just something to know. I personally don't feel like you need to spend the money on getting something to hold the drains. Just wear a bathrobe that ties at the waist, and they'll be fine. Especially if you have reconstruction and they give you a mastectomy bra or any sort of thing that is going to hold the drains up. Like, they do that. So I'm glad I didn't get those. They also sell for like $40. You can get a special pillow to go underneath the seatbelt strap. So when you're driving home, the seatbelt isn't compressing on the new tender tissue, which is logical. It makes sense. But also it's like $30 for just a pillow to wear back home from the hospital once. Didn't buy it. Just didn't wear my seatbelt on the ride home. So didn't need that, didn't spend the money on that. And also they sell these little like support pillows that go underneath your arms, so that when you're lying in bed, the weight of your arms is not pressing down. And I have not found that I needed that either. But when I go to bed at night, I just have regular small throw pillows that I prop up next to me, that I had slept with on my, just, sort of prop myself up with a bunch of pillows that I already had. So again, like, if you're going through this, you don't need to spend all the money on these little gadgets and frilly. Unless you want them, unless you like them, that's fine. I have not found any of that stuff necessary, and so I'm glad I didn't go out and spend the money on it. Okay, so what else? The drains. Talked about the bra. So the boobs look weird. They look like Barbie boobs. If Barbie boobs were normally proportioned to an actual human being and small. They are small. The surgeon said that they're the same volume as my original breasts were, but they might look or seem bigger because they're higher and rounder, which she had told me before, and I think I put that in one of the other posts. I don't know, I kind of feel like they actually seem smaller, but that doesn't matter because they're weird, and if they were bigger, then it would be even weirder. But just the shape of them, the shape is they're very plastic. They're very formed and solid, and they just, and they did take out the nipples, so she reconstructed little nipple-esque things to make it look like there's like a little, so that there is some sort of 3D shading there, which then later on we'll go back and she can tattoo an areola around it so they actually look like nipples. But for right now, it's just all one color, so it's like this all one color, sort of quasi roundish cone shaped plastic thing that's sticking out of my body, and it just reminds me of a Barbie doll. That's all I can say. It just reminds me of a Barbie doll. And they have no feeling. Like I touch them and I'm like, oh. Like even touching underneath, like literally, I could be touching a table. Wouldn't matter. Like I feel my finger feels like it's touching something, but the something that it's touching does not resonate. So people get back varying degrees of sensitivity, but all the nerves are gone. I mean, they sever everything. So yeah, so it's weird. It's definitely weird. But I feel good. I'm glad that it's behind me now. And the last piece we have to wait for is the pathology report to come in. So since they've removed all the tissue, they're going to send it out to a lab and they're going to test it to see how aggressive the tumors were. And so that's the final piece when it comes to the staging question, which a lot of people ask me, what stage are you in? For breast cancer, I guess they don't make the stage until they remove the tumor, at least in my situation. So they'll test it and they'll say whether or not the tumor is super angry and mad and wants to spread everywhere, in which case it would be a higher stage, and in which case they would recommend that I do some sort of follow-up treatment like a radiation or chemotherapy, or they come back with the pathology report which says that the tumors are kind of chill and they're just not super aggressive, in which case I will hopefully then be done with any kind of major treatment. And there'll be sort of maintenance treatment going forward, which will then involve meeting with the oncologist, and that's going to be just a whole separate chapter. But hopefully the pathology comes back mild. I mean, I don't really know what the terminology would be for it, but non-aggressive, mild, whatever, so that they don't then tell me that I need some further treatment. So that's it. So that's the update, and yeah. So feeling good. Feeling weird. The most of the pain is on the outside. Apologies for this. Like the outside and down here, where the implant and the dermal matrix that the implant is in is sewn to the chest wall. So this is really where the majority of the pain is. It's on the outside. I don't really have any pain in here. A little bit of tenderness. Nothing really up here, even though it's sewn in all the way around. But where I feel it is out here. And I imagine that's probably why, they, sorry again, why they say, you shouldn't be moving my arms a lot, shouldn't be lifting things, doing a lot of stuff like that. So I think that's it. That's the update. Thanks everyone again for watching, and I'll check back with you in a couple of days, let you know how things are progressing. Okay, thanks. Bye.